Welcome. Occipital headaches, occipital visual problems. I want to show you the correlation between the back of the occipital or upper cervical spine and what happens behind the eyes. Underneath the occipital region, you have the greater occipital nerve root that goes over the head behind the eyes. Quite common, people who spend a lot of time with their head in a flexed position, arms elevated, just muscle contracture within the neck area. Those muscles, particularly the upper trap muscles, pull behind the occipital region called the EOP, the external occipital protuberance, which sits right about back in here. So if you got muscles that are pulling and tugging, it's very common that the suboccipital nerve roots can become inflamed. If you look at the nerve chart here, you can see that the nerve underneath the back of the skull goes over the head behind the eyes. You can have visual changes. You can have headaches behind the eyes. Very, very common with occipital headaches. The area behind our skull generally affects up in the frontal part behind the eye area. Some very important tips I want to give you pertaining to these headaches or pertaining to pressure you're getting in the suboccipital area. They can call it suboccipital neuralgia, cranial neuralgia, cervical neuralgia in the upper part. This is a very, very common symptom because mainly of forward head posture. We got a reversal kyphosis now instead of a normal lordosis. Therefore, we have extra tension and pulling in the suboccipital area, affecting nerves underneath the suboccipital area, which goes over the head behind the eyes. So remember that for every inch our head goes forward, our head weighs 12 pounds, additional inches, 10 pounds. That's 1 inch, 22 pounds, 2 inches, 32 pounds, 3 inches, 42 pounds. And more than this, you can do the math, just gets worse and worse. Excessive tugging of these ligaments, muscles, and they're going to become inflamed. Eventually, the neck goes through deformation. You're going to lose the curve in your neck. You're going to start becoming possibly even kyphotic or reversal of the curve. Now you've got excessive weight bearing of the head, putting stress on the discs, leading to disc degeneration, and the list goes on. So what I'm concerned about with you is that I like you to really practice those chin tucks, making sure we're bringing the chin back from the side, just keeping it level, tucking back, going forward, tucking back, holding about 3 seconds, going forward. Okay, those chin tucks are good for the anterior flexor, deep anterior flexor muscles. But what I want you to concentrate, of tucking the chin in. Okay, when you tuck the chin in and you work, you're allowing the ears to stay level with your shoulders, because every inch those ears go forward is that much weakness and stress you're going to feel behind the skull. Generally, people will complain of a lot of tightness and pulling behind the neck muscles. I like ice. Ice underneath the skull, your headaches may go right away. I like you to also be able to take your head, okay, back both hands, bring your chin to your chest and pull it down. Good. Then bring your chin to the left, put your chin to your chest, pull it down. Go to the right. You can hold that pull about 10 seconds. You'll feel those muscles stretch underneath the back of the skull. So another thing is I want you to be aware of arm position. If you're doing a lot of driving, a lot of work on the computer, your arms are elevated, using tools around the house or your occupation, you cannot leave the arms elevated for long periods of time, because these upper traps attach behind the skull. If those muscles become overcontracted, it's going to cause excessive tightening and pulling, which is going to continue to cause those problems underneath the skull and affect those nerves. Those 3 tips are great little tips. Hopefully you use those. I ask you to share this video, leave your comments below. Subscribe if you haven't, so you can continue to receive the best of the self-help videos here about spinal health on the internet. And most important, make it a great day. I'm Dr. Alan Mandell.